Hi, I'm Claudia Gibson, Executive Vice President for the National Association of Community Health Centers. Let me tell you a little story, a quick story. The year was 1971, and a small group of community and provider activists, a few years before 1971, had been busy opening up what we used to call neighborhood health centers all over the country. They came to realize that they needed to come together in order to advance the burgeoning health center movement, and they needed to unite through their common mission. They also recognized there was a need for them for training, technical assistance, advocacy, and policy analysis, particularly since the little group's funding at the time was through the federal government, and the federal government considered them an experimental program. So they knew that if they were going to advance this wonderful model, they would need some voice in Washington, D.C. Thus, the National Association of what was called the National Association of Neighborhood Health Centers was born. Flash forward to 50 years later, here in 2021, the National Association of Community Health Centers still represents the strongest national voice for America's health centers. We're stronger than ever, and I hope you will join us this year in celebrating this significant milestone for the health center movement. Before we begin, and on that note, I want to thank you for joining us today for the first of what we are going to have as a new monthly webinar series called Propelling Our Mission Forward in NACHC's 50th year. As for those of you who may have joined us from Texas, I do want to, on behalf of everyone listening, to extend our heartfelt prayers and thoughts with you, because I know this must be a very challenging time in Texas for you, your family, your boards, and your staff. And now I'd like to call on NACHC's President and CEO, Tom VanCoverden, who would like to say a few words.
Thank you, Claudia. I'd like to say thank you to you and to Rachel Gonzalez for putting the program together with the NACHC team. And Dr. Choucair, again, talking just to you last week, thank you again for being a part of this so very much. And thank you to all of you, our frontline workers at the community health centers each and every day, making things happen. And you've done so for all the number of years that Claudia is talking about, while we've expanded and grown the program together. Let me just say, early on in the Biden administration, we had talked with a number of task forces who reached out to us and said, guys, this is what we're looking at doing, not only with regard to COVID, but to trying to get more care to minority communities and more people immunized, trying to build the capacity for primary care and outreach in those communities, for trying to recruit and train healthcare professionals, and to develop infrastructure, including telehealth and other ways to make sure we reach the hard-to-reach populations and those often overlooked. And so, Doctor, certainly we commend the President and the entire workforce, your workforce, and the number of committees that we are working with on other key issues. We're here to support and do anything and everything we can to help. And I know that speaking for all of the health centers, our partner state primary care associations, the health center community networks, and our affiliate organizations. So again, thank you so much for that partnership. Just echoing what Claudia said, a big part of our success has been the strong relationship we have had working closely hand in glove with the administration, with the government, particularly with HHS and with HRSA. Within there is an agency, the Centers for Disease Control, at times NIH and FDA, et cetera. HRSA is, of course, our mother agency. Jim McRae, you, Dr. Padilla, you guys, just an incredible group of folks who, again, work hand in glove together to make sure that we do more than talk about good things, that we do more than do good things, but that we report on our progress. And I think that was a key part and is a key part of what we're doing now with the COVID vaccinations. So I know in the discussion yesterday, I don't want to get into HRSA's presentation, but literally the number of people that have had their first shots and second shots, we're doing on a weekly basis recording, again, meeting weekly with the HRSA administration folks and CDC to do that. So again, part of the big key to our success has always been data, data, data. What are we doing with COVID? It's the data, the reporting back. We're with you every step of the way, Doctor, in what you're trying to do here. The other thing we do is document the cost savings and where we stand with health disparities and how our healthcare outcomes, whether it's infant mortality, immunization rates, and other key things, the Million Hearts campaign, heart problems and other things that we're getting out there to help get early and prevent illness and disease and serious illness along the way. The other is documenting the cost savings that these programs, in fact, more than pay for themselves. We are so happy, Doctor, to be partnering with you. Thank you for today and all that you're doing.
Thank you, Tom. And now I'd like to give everyone a few housekeeping notes. A recording of today's webinar will be available on NAC's website, www.nac.org, in 3 days. Q&As will not be featured today, but our NAC staff will be monitoring the chat box and will address any questions after the webinar. And as a bonus feature, each of the webinars that we will be holding in the coming months, we will spotlight some of the many programs and services that NAC provides in support of the health centers in the field. Our very first spotlight feature today is being brought to you by Margaret Davis, NAC's Director for Knowledge Management and Learning. Margaret?
Hello, thank you so much for joining us today. Like you, I'm looking forward to the discussion on the national COVID vaccine effort and how health centers play an increasing and vital role. Before we get started, I want to direct you to 2 key areas where NAC is providing communications and peer resource sharing to support health centers as you ramp up vaccine services in your communities. First, I'm going to take you to NAC's COVID-19 page found at nac.org/coronavirus. This webpage has expanded through the pandemic and includes a wealth of information and FAQs on a wide range of topics, including testing, telehealth, impacts on finance and operations, data, and more. Today, I'm going to show you our new Communications Toolkit page. From the blue bar on the left side of the page, you will see a link to the COVID Vaccine Communications Toolkit. This new page is where you will find FAQs as well as templates for public service announcements, press releases, and social media posts. We also have printable posters and selfie signs. And probably your internet will work better to click over there and you can find it really easily. We have compiled key vaccine confidence messages that have been studied by the CDC, FDA, and others, and proven most effective to improve vaccine acceptance. You can tailor these messages for your specific populations. We welcome your feedback and input on this page and the resources here. Next, I'm going to show you take a little tour of the Health Center Resource Clearinghouse, including our new peer sharing opportunity for health centers. As you may know, the Health Center Resource Clearinghouse, managed by NAC, is a HRSA-funded collaborative project of all 21 national training and technical assistance partners, and including representation and resources from PCAs and HCCNs. The main page at healthcenterinfo.org, you can click on this red button to get to the COVID-19 resources page. This updated COVID-19 landing page is your one-stop shop to all coronavirus resources in the clearinghouse. From here, you can access tailored and health center-specific information on vaccine distribution, resources on emergency management and operations, financial management, governance, and specialized materials for special and vulnerable populations. You can also access our COVID-19 newsletter that keeps you informed about the latest resources that have been added to the collection and new features on the website. Let's go to our vaccine distribution page. Given the rapid evolution of the health center involvement in the national vaccine strategy, we have set up this page with categories to highlight federal guidance, local, regional, and state collaborations, vaccine confidence communications, and operational manuals and toolkits. As part of our collection principles, the Clearinghouse focuses on collecting and curating vetted resources from HRSA-funded training and technical assistance partners. However, response to the COVID-19 pandemic is rapidly evolving and requires new and emerging strategies to maintain clinical services and stand up vaccine and testing sites. To support these rapid changes, the Clearinghouse is now accepting your sample procedures or templates, and they will be included and searchable among all the other training and technical assistance resources. With a click on this button, you can fill out a simple form and upload your samples. Health centers have a long history in supporting one another, and we're excited to add this new feature to accelerate peer-to-peer information sharing across the health center program. If you have any questions about the Clearinghouse, you can email us at info@healthcenterinfo.org. And with that, I want to thank you very much and pass it back to Claudia so we can get started on this wonderful panel presentation.
Thank you, Margaret. I encourage everyone to check our website often for updates. Margaret and her team are always updating it in concert with our federal partners and others. So thank you, Margaret. Okay. All right, now let's turn our attention to our main event for today by introducing today's distinguished speaker and our distinguished panel. First up, I'd like to introduce you to Dr. Bechara Choucair, who serves as the White House COVID-19 Vaccinations Coordinator. In this capacity, his focus is on coordinating the timely, safe, and equitable delivery of COVID-19 vaccinations for the U.S. population in close partnership with relevant departments and agencies, as well as state and local authorities. In this role, he also leads the administration's ambitious effort to administer 100 million vaccinations in 100 days. Prior to joining the administration, Dr. Choucair served as a senior VP and Chief Health Officer at Kaiser Permanente, where he oversaw the organization's efforts focused on addressing the social health of its 12.2 million members and the 68 million people who live in the communities that Kaiser serves. His work included the creation of the nation's largest social health network to meet the housing, food, and transportation needs of its members. He also managed Kaiser Permanente's community health portfolio, including $3.4 billion dedicated to supporting medical financial assistance and charitable care, as well as grants and community health initiatives. Before his time at Kaiser, Dr. Choucair served as the commissioner of the Chicago Department of Public Health for 5 years before serving as senior vice president of Safety Net and Community Health at Trinity Health. Lastly, we consider Dr. Choucair one of our own, having served at 2 community health centers in the past. One at as medical director of Crusader Health Center in Rockford, Illinois, and as CEO of Heartland Health Center in Chicago. Also joining us today are 2 wonderful, wonderful people who some of you may know, our panelists who will bring their state and local perspectives to the conversation with Dr. Bechara. Naomi Fuchs is the CEO of Santa Rosa Community Health Center in Sebastopol, California, and Henry Taylor, CEO of Miles Square Health Center in Chicago, Illinois. Mr. Taylor is also NACHC Speaker of the House. Henry, I'm now going to turn things over to you.
Well, thank you, Claudia. Thank you, NACHC family and special guests. I'd like to say thank you to Dr. Choucair for joining us. And Dr. Choucair, as Claudia indicated, is one of our own. Dr. Choucair, my first question is really related to your overall role as White House coordinator. Yesterday, we sort of commemorated the loss of 500,000 souls who lost their lives due to this virus. Can you give us an overview of the White House approach to the vaccine rollout program and how you see community health centers playing a major role in driving a solution to this problem?
Well, Henry, thank you so much for having me here. It's always great to be with my colleagues at NACHC and the Community Health Center movement. Just like Claudia mentioned, I have learned so much from my days at community health centers. I trained in a community health center. I was a clinician in a community health center, and I practiced in a healthcare for the homeless program. I was a medical director. I was a CEO, I was executive director of one of the FQHCs in Chicago. So I will be forever grateful for all the people I met during my journey with the federally qualified health centers across the years, and in all my patients that I've learned from, and all my colleagues that helped me become a better person. So let me start there by acknowledging that gratitude that I have for the community health center movement. I also, Henry, over the years, I'm grateful for your support and your coaching and your engagement throughout my years in Chicago. So thank you for that. And it warms up my heart that you're part of the panel here today. Before I jump into the administration's vaccination plan, I do want to take a moment to touch on this grim milestone of more than 500,000 people losing their lives in this country to this pandemic. And, you know, it goes without saying that this is unbelievably heartbreaking, and nothing we can say or do can make it better. And the president said yesterday, the way through sorrow and grief is to find purpose. And for me, for our team, and I know for all of you, that purpose is to end this pandemic quickly and end it equitably. And we all have a role to play. So I just wanted to take a moment to reflect on those 500,000 lives that we've lost as a country. Now, let me just shift gear here and talk a little bit about the Biden COVID-19 vaccination strategy. You know, the president on his first day in office launched our national strategy for COVID-19 response. And that strategy, he's been from day one saying that the strategy is always going to be based on data, based on science, based on public health, and not based on politics. And if you look at the multiple tenets of that overarching strategy, it's about restoring trust with the American people. It's about mitigating spread. It's about immediately expanding emergency relief. It's about safely reopening schools and businesses and travel. It's about protecting those most at risk and advancing equity across racial and ethnic, as well as rural and urban lines. It's about restoring the US leadership globally and building better preparedness for the future threats. And it's also, of course, about mounting a safe, effective, and comprehensive vaccination campaign. And that's what I'm happy to be spending the next few minutes and 20, 30 minutes throughout this panel talking about. And there are two big components to this strategy. Well, actually three. One, we want to make sure that we're increasing supply of vaccine. And I know this is front and center to everybody's mind. We want to increase the number of vaccinators across the country. And then three, we'd want to provide more places for people to be able to get vaccinated. And the federally qualified health center is one of these programs that helping us achieve that. So I'm happy to give an overview of our supply, where we've been and where we're going. I'm happy to give some examples of how we're adding to the places where people can get vaccinated, if you'd like me to, Henry.
Sure. Just a brief overview, if you don't mind. That would be grand.
Sure. So let me start with supply, because I know this has been front and center to everybody's mind. We've been working really hard with manufacturers to make sure that we are providing more and more vaccine across the country. And if you look at January 19th, about 8.6 million doses of vaccine are administered weekly to states, tribes, and territories. As of this morning, we've just bumped that up to 14.5. So from 8.6 to 14.5, that's almost 70% increase in vaccine supply in about 5 weeks. And also in line with this effort, we're providing more visibility to states, tribes, and territories for a minimum of 3 weeks so that they can plan accordingly. We've also worked on ensuring that the Pfizer kits includes all the syringes and the supplies that they need to be able to extract that 6th dose. which is an important part of increasing supply. And as you all know, the president announced that we will be purchasing 200 million more doses, 100 million more of Moderna, 100 million more of Pfizer, for a total of 600 million doses that will be available this summer, which means 300 million people in this country could get vaccinated as we continue to beef up supply. So a lot of work on supply. On the other side, we wanted to also make sure that there are more and more places for people to be able to get vaccinated. So we've been working with FEMA and states around building up more community vaccination centers across the country. In the last 5 weeks, FEMA has obligated $3.8 billion in 44 states, tribes, and territories to support standing up more community vaccination centers. This also includes providing staff to support these community vaccination centers. We've assigned over 1,300 FEMA staff to support these sites. We've deployed over 800 vaccinators, and we are standing up sites with states like in California, Texas, and Florida, and New York to be able to get more places for people to get vaccinated. The other program is really around the pharmacies, where we've partnered with 21 pharmacy chains across the country, and we're making the vaccines available in over 6,000 pharmacies across the country. And the program that I'm really, really excited about is the program we've launched a couple of weeks ago with community health centers to make sure that our federally qualified health centers, who are doing a fantastic job and taking care of people in this country who are living in poverty, diverse group of patients, people experiencing homelessness, migrant workers, residents of public housing, people with limited English proficiency. So that very first phase of this program is up and going. We are now already, a small set of thoroughly qualified health centers can actually order the vaccines, and we're shipping them vaccines this week. And we're hoping to be able to increase the number of federally qualified health centers that are participating in this program as fast as we can.
Outstanding. Naomi, I think Naomi has a couple of questions as well.
Absolutely. Thank you so much for that overview, Dr. Choucair, and all you're doing to make sure we're getting the resources we need to do our work and to help vaccinate our country. As we're all very well aware, this pandemic has really brought to light to the whole country, the people outside of the movement as well as inside, the lack of equity across healthcare system and the decades of structural racism that really has become an existential threat to many in our community as they experience the COVID. And we see this disparity at our health center directly. The people we're testing, we have a 28% positivity rate with our patients compared to 5 to 6 in the community at large. So with health equity and health justice at the core of all of our health center missions, how can you leverage our expertise to make sure the spoken goal about equity is actually realized in our communities? Nope, we can't hear you.
So much, Naomi, and it's
Thank you.
Also, great to be with you. I'm glad we got a chance to work together during my tenure at Kaiser Permanente when your health center was stepping up to respond to the fires. It's a different type of disaster, but very real disaster, and I'm really glad we got a chance to meet and work together on that front. Let me just start by saying equity is at the core of our national vaccination strategy. And I know a lot of people will be thinking about, do we want to think about speed or do we want to think about equity? And I think we've been really clear that it's about both. And equity will always be the cornerstone of our approach to addressing the vaccination issues. Now, let me start by saying our partnership with all of you on the Federally Qualified Health Center is a perfect example of how we're taking that type of approach and really translate it into programs that's making a difference into people's lives in the communities. You know, almost 30 million people, and I know everybody on this call knows, are being served across this country by federally qualified health centers, 2/3 of whom are living at or below the federal poverty line. About 60% are racial or ethnic minorities. So the partnership that we're creating with making sure that federally qualified health centers have a direct allocation to those sites to be able to vaccinate communities where they operate, vaccinate their patients who've built that trust and that built that confidence and that connection with their doctors and nurses and social workers and front desk staff and medical assistant is a critical example, is a key example of how we're living that equity focus that we're talking about. We've also been very clear in our work on building more community vaccination centers, that the framework that we're looking at is making sure that we are looking at the social vulnerability index when we're thinking about where we place. We make sure that communities that are struggling the most or communities that are disproportionately impacted by the pandemic is having an opportunity to get vaccinated. We're not only thinking about fixed sites, but we're also thinking about mobile sites. So how does it look like for us to be able to support our fixed community vaccination sites with mobile capacity, whether it's through a mobile van that's going and partnering with communities and CBOs across the community, or through doing pop-ups in a hub and spokes type of modality. And we're working on that in many of our current facilities. So for example, the 2 California community vaccination center, one in East Oakland and one in East LA, have mobile capacity that's attached to them. And the teams on the ground are working with a network of community-based organizations to make sure that these sites are going to those locations, are able to get people vaccinated who might not be the type of people who'd want to go and stand in line in a community vaccination center. So that's another concrete example of how we're thinking about that. The third thing I would say, Naomi, here is the real important focus on data. And I know federally qualified health centers are really good at reporting data by race and ethnicities, and we'd want to continue that movement. We'd want to continue this beyond the FQHC world and engage other providers, pharmacies, and the community vaccination centers and health systems to be able to report the data so that we can customize our approach and be able to figure out where we need to make a difference. So there's a lot of work that's happening on that front. And then one last thing I'd want to mention, and this is part of the president agenda, and that's on January 21st, he did sign an executive order to create a task force to address COVID-19 related health and social inequities. This task force is based at the Department of Health and Human Services and is chaired by my colleague, Dr. Marcela Nunez-Smith, who I think you're going to be, you know, and you've been working with. The president has selected 12 non-federal members to the task force 2 weeks ago. I know there was a representation of the federally qualified health center movement. I think Bobby Watts from the National Healthcare for the Homeless Council is there, a couple of other folks. And this group brings that diversity of backgrounds and expertise. The task force is charged with issuing a range of recommendations to help inform pandemic response and recovery. And those recommendations include recommendations on equitable allocation to COVID-19 resources and relief funds, effective outreach and communication to underserved and minority populations, data collection, as well as improving cultural proficiency within the federal government. So equity is a critical part of our administration's response, and this task force is an important part of that effort.
Thank you so much. Henry?
Thank you, Dr. Choucair. It's clear that from my perspective that there's a man, woman, or person for every moment, those extraordinary moments in our lives. And hearing you present today, it is clear that you're the person for this moment we have in our country in terms of getting us back to some degree of normalcy. Give me an overview, or give us an overview of how your past has shaped you and prepared you for such an extraordinary role. I mean, this is no small task that you have. So give us an overview of how that has come to be.
Well, let me start, Henry, by saying it's going to take all of us to be able to get us past this pandemic. And I continue to be humbled every day when I talk to people who are doing outstanding work that help me think better about my role, that help shape our response and strategy in a way that's unbelievable. So I'm going to start by acknowledging the outstanding work that everyone on this call has done over the last year or so in responding to the pandemic. I've spoken to so many FQHC leaders over the last year who are struggling with how to make sure they keep their doors open. They make sure that they're connecting with their patients through telehealth services. How can they make sure that they're paying their staff? How can they make sure that they're there to support their patients when they need medications? And I stand in awe for the outstanding work that I've seen across the country over the last year in talking to so many of the outstanding leaders in this country. You know, I had a chance to spend many conversations with Jane Garcia and La Clinica in Oakland. I have spent multiple conversations with Warren Brodeen and others in Southern California. And I know that organizations across the country have stepped up. So I am humbled to be part of that movement that's helping getting us past this pandemic. And I have to tell you, Henry, I mean, when I immigrated to this country in '97, I had no idea what to expect. And I landed in a family medicine residency program that's embedded in a community health center in Northwest Houston, serving immigrants, Mexican immigrants mostly, and get to do some time with some work with the Healthcare for the Homeless program with Dave Buck and his team at the time. And that's not the America that I expected. You know, as a little kid, you grow up in Lebanon, you have a very different image of what America is. And when I got here and I started that work in this community health center movement and Healthcare for the Homeless program, it really shaped my career. And I'll be forever grateful for all the opportunities that I've had throughout learning from my patients, from my colleagues, from people I met along the way. And I have to tell you, there's one person who's so dear to my heart, who shaped a lot of where my career is today, who unfortunately is no longer with us, Doris Gray, who was one of my patients who ended up being one of the board members at Heartland Health Center in Chicago. And she's been a fantastic cheerleader, supporter for me throughout those years. And unfortunately, she's no longer with us. But it's those types of experiences, Henry, as you know, and all of you know on this call, that really shapes our careers and honestly make us better people, not just better professional. And I'm grateful for those opportunities.
Outstanding. Naomi?
There we go. Thank you. So let's turn a little bit now to lessons learned. I mean, I know we're in the middle of it and we're still lots to learn as we go, but if we're building the plane while we fly it, let's try to learn. I know here in Sonoma County, our health department doesn't have any infrastructure to actually deliver services. So the great learning here has been about collaboration and working across all the health systems and the health centers and the public health department to try to deliver this vaccine effort. And we've now vaccinated more than 20% of our community. But it's clearly demonstrated how fractured and some might say broken our healthcare delivery system is. Is there any advice you can offer us as health centers on things we could be doing better, what we could learn, and what you've learned from this process so that we can be more effective in supporting the vaccine effort?
Thank you, Naomi. And I'm going to go back to a comment I mentioned earlier. It's going to take all of us to be able to get the country vaccinated and getting us past the pandemic. And everyone is going to have a role to play and is having a role to play. I think one of the key messages for me is to make sure there is a lot of alignment between community health centers and local and state health departments. And I've been in places across the country where there is a lot of alignment, there's a lot of planning together, there's a lot of coordinated effort, and I've seen the other extreme as well, and a lot of the places are in between. And the reality is, for us to be able to respond to this pandemic effectively, we have to bring the healthcare system and the public health system together. We can't be thinking about public health in one silo and healthcare in another silo, and we have to be thinking of those together. So the more we plan together, the more we coordinate together, the more we step up and support each other, the more likely we're going to be able to get this country vaccinated and getting us past the pandemic. And honestly, the community health center program that we provide direct vaccine allocation to FQHC is supposed to add to those relationships that you already have with your local health department, with your state health department. You know, I had the opportunity to be in both worlds. I was in the FQHC world for a very, very long time. I ran a local health department in Chicago, and I know how much more added value when both come together to be able to get us to where we need. And I know you asked about lessons learned. I think one other thing I'd want to share with this group is the value of active listening. I've been on this job now for 5 weeks or so. I've spent so much time with a lot of people trying to listen carefully, listen actively, try to see what's working in our communities, what's not working, how can we tailor our response in a way that would make a difference in the communities that we're serving? How do we make sure that we're lifting up best practices that are really addressing inequities head on? And I've seen some beautiful examples. You know, some of the efforts that's happening in Chicago about identifying a few zip codes and vaccinating people there, irrespective whether you're part of the eligibility criteria or not. Other examples in Massachusetts and other places that are really looking at this equity lens as you're delivering your programs. Learning from each other is going to be so critical in the weeks and months to come. So I'm so glad we're doing part of that here through this webinar, Naomi.
Thank you. We look forward to the continued partnership.
Well,
Henry?
Yes, thank you so very much, Dr. Choucair. I want to thank you for your extraordinary work, the work you've done over your time in Chicago and certainly California, and joining us today. And thank you for, there was a play out a few years ago that said, being in the room when it happened. So thank you for allowing us to be in the room and be with you where it's all happening. And I'm going to turn it over to our host, Claudia. Claudia, the floor is yours. Thank you so very much.
Thank you, Henry, and certainly thank you, Dr. Choucair. It's so nice and refreshing. I think everybody online will agree with me that it's refreshing to hear an administration official talk about active listening for a change. And thank you, Henry, and thank you, Naomi, for joining us today. And special thanks to the NAC team who brought this webinar to fruition. And I just want to close on a few more housekeeping notes just as a reminder. This program will be available for viewing 3 days from now on the NAC website. We ask you to save the date for the next webinar in the series. That will be March 30th. Details about the topics and the speakers will be released soon. We also hope that you will join us for the upcoming Virtual Policy and Issues Forum, a very important conference this year for all of us. The dates are March 15th through 18th, and Board Member Boot Camp will be March 14th. So you should visit our website for registration and information on the schedule. And lastly, please join us throughout this year in celebrating NAC's 50th anniversary. It's not only NAC's anniversary, but it's the movement's anniversary, and we hope that you will join us this year. So that will conclude today's program, and I encourage everybody to keep up the great work. It provides a shot in the arm, so to speak, to the NAC staff, and we're here for you. Thank you.